perfect, the Affordable Care Act was a serious attempt to solve a serious problem. By contrast, the legislation we are considering today is not serious, and the only problem it portends to solve is offering new members of this body the opportunity to vote on a bill that isn't going anywhere. I assure you there is no lack of real problems for this body to address. As of March, the unemployment rate for most of my congressional district was at 7%. Does anyone in this chamber think we should sit on our laurels with 7.3% unemployment instead of holding 37 votes to repeal the Affordable Care Act? Is it too much to ask that we just hold one vote on the American Jobs Act, legislation that included both Democratic and Republican ideas that would put more money in the pockets of small businesses and put countless Americans back to work? These political votes are a foolish waste of time, and the American people deserve better. In closing, I would urge my colleagues to oppose this blatantly political legislation and return to a focus on legislation that creates jobs, grows the economy, lays a foundation for sustainable prosperity, and doesn't strip away health care benefits for millions of Americans. I yield back.
Reserves. It's time. The gentleman from Tennessee is recognized.
Thank you, Mr. Chairman. At this time, I yield 2 minutes to the gentlelady from Minnesota, Ms. Bachmann, who is the author of H.R. 45.
Gentlewoman from Minnesota is recognized for 2 minutes.
Thank you, Mr. Speaker, and I thank the gentlelady from Tennessee, who has been a champion for the repeal of Obamacare for years and years. Mr. Speaker, in light of the recent revelations that have just come out within this last week regarding the outrageous activities of the Internal Revenue Service pointed against the people of the United States, every American should be concerned about the negative consequences of this bill, Obamacare. The Supreme Court has ruled that Obamacare is in fact a tax. Knowing that it's a tax, the logical conclusion is that the entity in the United States that will be tasked with enforcing tax policy is the IRS. I'm a former federal tax litigation attorney. I worked for the Treasury Department. We had only one client. It was the IRS. The IRS is the only entity that enforces tax policy in the United States, and Obamacare is enforced by the IRS, probably the most feared federal agency in the United States government. It concerns me. It should concern every single American listening to our voices today that the IRS has admitted this week that they directly targeted Americans, including Christians, including those who support the State of Israel, including those who are for jobs and less debt, including conservatives, Tea Partiers. They were targeted. Why? Because of what they believe, their religious beliefs, their political beliefs, and the IRS targeted them for punishment or for reward, depending upon how their ideas lined up with the administration's ideas. You see, this dysfunctional implementation of Obamacare and the ongoing assault on non-negotiable constitutional liberties is enough to convince every single one of us who are the people's representatives to seek full repeal of this law. It's our job, Mr. Speaker, to defend liberty. We're all sworn to protect and defend the Constitution, and that's why today we have to end this horrible piece of legislation and stand up for people. So I yield back, Mr. Speaker, and I thank the gentlelady from Tennessee.
Gentlewoman from Tennessee reserves. Gentleman from New Jersey is recognized.
Mr. Speaker, I believe the other side has more time, so at this time I would reserve.
Gentleman from New Jersey reserves. Gentlewoman from Tennessee is recognized.
At this time, I yield 1 minute to Mr. Salmon of Arizona.
Gentleman from Arizona is recognized for 1 minute.
Thanks. I ask for permission to revise and extend my remarks.
Without objection, so ordered.
Thank you. Mr. Speaker, I'm driven today to rise because I agree wholeheartedly with Senator Max Baucus that the Obamacare is a train wreck to our economy. As a proud co-sponsor of H.R. 45, I unequivocally support a full repeal of this onerous law. Since the Supreme Court has delineated it as a tax, it's clear that obligations or commitments to not raise taxes on the middle class have gone by the wayside. In fact, this will be one of the largest tax increases on the middle class known to man. In fact, there's a hidden tax in this bill on medical devices, life-saving medical devices. My mother, 90 years old, has a pacemaker, and that keeps her alive. Next time she gets one, she's going to have to pay a tax on that, and so is every other senior citizen that has a pacemaker. I think this is just flat out wrong. Also, Maricopa Community College District just recently reclassified 700 professors from full-time status to part-time status so that they don't have to pay this onerous tax. Mr. Speaker, this is a terrible bill. It needs to be repealed. Thank you. Yield back the balance of my time.
Gentleman's time has expired. Gentlewoman reserves. Gentleman from New Jersey is recognized.
Thank you, Mr. Speaker. You know, the gentleman from Arizona keeps talking about the terrible things in the health care reform, but let me just say, in his state, if the ACA was repealed, that would mean that in Arizona, drug costs for over 65,000 seniors would have been $102 million higher. 69,000 young adults would not have had coverage through their parents' plans. 917,000 women and 434,000 seniors and people with disabilities would not have had access to free preventive care. 414,000 people would not have received $28 million in rebates from their insurance companies, and next year, 948,000 people will not have access to quality, dependable health insurance coverage. So these are the facts, the real problem that happens in the state of Arizona if this bill were to pass and the health care reform would be repealed. I reserve the balance of my time.
Gentleman reserves. Gentlewoman from Tennessee is recognized.
At this time, I yield 1 minute to the gentleman from South Carolina, Mr. Sanford.
Gentleman from South Carolina is recognized for 1 minute.
Thank you, sir. You know, I rise with the chorus of others in this whole notion of repealing Obamacare, primarily because of its financial impact. At the end of the day, if you look at the Government Accounting Office numbers, what they show is that there's $6.2 trillion of cumulative impact here over the next 10 years. If you look at the Congressional Budget Office numbers, what they show is increasing numbers in $800 billion increments. And in fact, if you look at American tax reform studies, what they show are 20 new or raised levels of tax that go with this bill. I think more importantly, it turns on its head this whole notion of a Hippocratic Oath, which has been a 200-year tradition in this country of doctors working directly for a patient. And finally, and I'd say most importantly, it turns upside down this American tradition of not having the government force on the consumers the notion of the purchase of a product. It's for that and many other reasons that I join again with the chorus of others in urging the repeal of this bill. With that, I yield back the balance of my time.
Gentleman yields back. Gentlewoman reserves. Gentleman from New Jersey is recognized.
Mr. Speaker, at this time I'd like to yield to the gentleman from Maryland, the ranking member of our Budget Committee, Mr. Van Hollen, 1.5 minutes.
Gentleman from Maryland is recognized for 1.5 minutes.
Thank you, Mr. Speaker, and I thank the gentleman. Mr. Speaker, voting to repeal the Affordable Care Act for the 37th time is a waste of resources and another example of the refusal to focus on the important issues of jobs and the economy right now. It's also an example of bad budgeting. One of the things I don't think our Republican colleagues have focused on is that their claim to have a balanced budget rests on the savings and the tax revenue in the Obamacare bill. So if you repeal all of Obamacare, which this bill says it wants to do, the Republican budget will immediately be out of balance in 10 years. Here's how it works. If you look at the Republican budget, in 10 years, they claim that there's a $7 billion surplus. But the reality is, it also contains in it Medicare savings. We heard that issue demagogued during the last presidential campaign. And it also includes Obamacare revenue. And if you take out that over $400 billion in Medicare savings and the revenue in Obamacare, poof, the Republican budget is way out of balance. And, Mr. Speaker, it's not just me saying that. Here's what the Heritage Foundation said. They also point out that the Republican budget depends on Obamacare. So, long story short, you can't have it both ways. You can't repeal Obamacare and go home and tell people you did that, and at the same time say you have a balanced budget. Thank you, Mr. Speaker.
Gentleman reserves. Gentlewoman from Tennessee is recognized.
At this time, I yield 1 minute to Mr. Messer of Indiana.
Gentleman from Indiana is recognized for 1 minute.
I thank the gentlelady. I rise in support today of Obamacare repeal. I can't begin to highlight all the problems of Obamacare in 1 minute, so I will instead focus on this simple fact. Obamacare is the biggest assault on the 40-hour work week in this country in a generation. Under Obamacare, government mandates and penalties kick in for every employee that works more than 30 hours a week. Employers can't afford Obamacare's mandates and penalties, so they're scaling back the hours of their employees to less than 30 hours as a result. And that's bad for workers. It means many working moms will be forced to look for a second job to find the hours they need to pay their bills and feed their family. In my hometown of Shelbyville, for example, it has already meant that some part-time teachers' aides must work less so the local school system doesn't go bankrupt. That's bad for teachers and students, and the problems are just beginning. Mr. Speaker, it's time to repeal Obamacare and restore the 40-hour work week. 40 may be the new 30 when it comes to aging, but 30 is the new 40 when it becomes the Obamacare work week. I yield back the balance of my time.
Gentlewoman reserves. Gentleman from New Jersey is recognized.
I just wanted to ask the time again, Mr. Speaker.
Gentleman from New Jersey has 1.5 minutes.
And the Republicans?
Gentlewoman from Tennessee has 1.25 minutes.
Okay. And she closes. Okay. I yield myself the balance of the time, Mr. Speaker.
Gentleman is recognized for
Mr. Speaker, I just heard the gentleman from Indiana say we can't do this, we can't do that. I mean, this is the problem with the other side of the aisle, with the Republican side of the aisle. They always believe that we can't do anything here in the House of Representatives. The fact of the matter is that Democrats saw the problem. The problem was discriminatory health insurance practices. The problem was young people not being able to get on their parents' insurance policies. The problem was women not being able to access health care. And so many Americans, 40, 50 Americans that did not have health insurance. And what did we do as Democrats? We found a solution to the problem, which was the Affordable Care Act. And it is working. The discriminatory practices are going away, okay? More and more people are going to have health insurance. Most Americans will have health insurance by the beginning of 2014. And the donut hole for prescription drugs for seniors is being closed. All these things are answers that the Democrats have brought through the Affordable Care Act to the problem that existed with our health care system. And all I hear from the other side of the aisle is, we can't do this, we can't do that. Well, we've done something. Don't just come here and tell us we have to repeal it. As I said before, if you have a solution, you want to work with us to improve things, that's fine. But don't come here for the 37th and 38th time and say we're just going to repeal the Affordable Care Act. You never come up with a positive solution to the problem. In this Congress, all we hear from the Republican side of the aisle is we want to repeal everything. We want to waste time. Don't continue to do this. This bill is a complete waste of time. It passes here, it goes to the Senate, and nothing happens. Let's keep this bill, the Affordable Care Act, in place. It's doing wonderful things for the American people.
Time has expired.
Thank you, Mr. Speaker.
Gentleman's time has expired. Gentlewoman from Tennessee is recognized.
This law has become 13,000 pages of regulation. It has gone from costing $800 billion to $2.6 trillion. It's so interesting to hear people talk about solutions and wanting government to do things. Mr. Chairman, the American people can solve so many of these problems. They know the answers do not come out of Washington, D.C. They come from our communities. They come from our state legislatures. Solutions come from employers that are fighting every single day to keep people employed. One of the biggest impediments to job growth, indeed including the 800,000 jobs this bill will cost us. This law, Obamacare, costing us 800,000 jobs over the next 10 years, is keeping people working full-time. We know what the problems are. We're saying, look, admit it was a mistake. The American people don't want it. It's too expensive to afford. Let's get it off the books, and we do come forward with solutions. We come forward with keeping patient-centered health care centermost for our constituents. That's what they want. They want options. They do not want regulation and mandates by the federal government who can't seem to solve the problems that are in front of them right now, whether it's the IRS or anyone else. Let's repeal this bill and pass H.R. 45.
Gentlewoman's time has expired. The gentleman from Minnesota, Mr. Klein, and the gentleman from California, Mr. Miller, will control 20 minutes each. The gentleman from Minnesota is recognized.
Thank you, Mr. Speaker. I rise today in strong support of H.R. 45, the legislation that will repeal the President's job-destroying health care law, and yield myself such time as I may consume.
The gentleman is recognized.
Thank you, Mr. Speaker. Mr. Speaker, our nation is mired in a jobs crisis, and the President's health care law is making it worse. Since Obamacare was first enacted in 2010, federal bureaucrats have written nearly 20,000 pages of new regulations. 20,000 pages. Colleagues on the other side of the aisle have talked about how many times we've tried to get rid of this menace and what's changed. Well, as we know, very famously, we had to pass the bill to find out what was in it, but even then we didn't know what was in it. We're now at 20,000 pages of regulations and still counting. Meanwhile, America's job creators are struggling to manage the full effects of the law in their workplaces. Ed Tebel has owned and operated Sonny's Real Pit Barbecue for more than 30 years. At a recent hearing in North Carolina, Mr. Tebel outlined the difficult choices he now faces, including higher prices for customers and fewer hours for workers. Brett Parker, Vice Chairman of Bowmore Lanes of New York, testified in 2011 that his business may also have to shift workers to part-time hours in order to, quote, protect existing jobs. As Chief Human Resources Officer with Rowan Cabarrus Community College, Tina Haynes stated the college must consider cutting the number of courses offered to students. She also described the health care law as a, quote, massive administrative burden that comes with unanticipated costs, close quote. And Gail Johnson, President and CEO of an early childhood learning center, warned in 2011 that Obamacare would, quote, force entrepreneurs to invest less into growing their business, close quote, and slow the growth of small businesses. These men and women live each day with the consequences of the health care law. No doubt others from across the country have similar stories to tell. There are a number of good reasons why Congress should repeal the government takeover of health care. It is driving up the cost of care, and millions will lose the health care coverage they have and like. Yes, Mr. Speaker, if you like your coverage, you may not be able to keep it. According to CBO, at least 7 million people fall into that trap. But for many Americans, one reason stands above the rest: jobs. Our nation's workers and employers cannot afford the Democrats' job-destroying health care law. I urge my colleagues to vote yes on H.R. 45, and, Mr. Speaker, I yield the balance of my time to the gentleman from Tennessee, Dr. Rowe, and ask unanimous consent that he be allowed to control that time.
Without objection, the gentleman from Tennessee will control the balance of the majority's time.
Thank you, Mr. Speaker.
Tennessee reserves. The gentleman from California is recognized.
Thank you, Mr. Speaker. I yield myself 4 minutes.
The gentleman is recognized for 4 minutes.
I rise today in opposition to the Patients' Rights Repeal Act. Mr. Speaker, we meet today for the 37th attempt to take away the basic health care rights from millions of Americans. Yet, despite all of these votes, the Affordable Care Act remains the law of the land, and it will remain the law of the land even after today's vote. That's a fact. So why are we here for the 37th time? Are Republicans afraid that Americans are now able to get basic preventative health care screening with no co-pays? Are they afraid that Americans will now no longer be gouged by denying coverage because of pre-existing condition? Are Republicans fearful that the insurance companies can't cut off life-saving care just because somebody got sick? Because they can't do that now with the Affordable Care Act. Why on earth would anyone fear American families being put back in charge of their health care? But we're here yet again to satisfy the majority's needs to have another meaningless vote. This obsession of repeal by the majority is bordering on the absurd. It's time to move on, for goodness sakes. Open season is set to begin 5 months. Americans without affordable insurance will be able to shop for plans in an open and transparent marketplace with the help of tax credits for those who qualify. Employees of small businesses, employers of small business will be able to shop for appropriate health care for their employees and for their businesses with the help of tax credits. It's our duty as public servants to help our constituents navigate this new law, not spend our time obstructing it. That's how California has approached the reform. We've worked in a collaborative way with all of the stakeholders. That's how the government should work, because they know that it will help families struggling to afford health insurance. Take, instance, a family of 4 making $60,000 in California who buy their own insurance. Today they pay some $12,500 on average for insurance. That's more than $1,000 a month. But starting in January, this family will save almost $5,000 a year because of the Affordable Care Act. Think about what this family can do with that extra $400 a month. It means paying your bills. It means saving money for your kids' education. It means repairing your car. This is what the Affordable Care Act can do. This is what Obamacare does. This is what the Republicans are trying to hide from the American people. Our country has debated health care for more than a century. They keep saying there's other alternative solutions. It's funny, none of them came forward. None of them came forward during this debate with those alternative solutions, and health premiums were skyrocketing in double-digit year after year after year. For decades, we debated how to make sure all Americans have access to health care that won't bankrupt them if they get sick. For decades, we debated the control of the national health spending by ensuring that everyone is covered. For decades, we debated how to control uncompensated care that costs families dearly. And it took the leadership of Speaker Pelosi and President Obama to bring positive change for families, businesses struggling under the weight of health care costs. The fact of the matter is, this plan currently today is working for millions of Americans, for millions of seniors, for millions of young Americans, for millions of young people born with pre-existing conditions. That's what this legislation is about, lowering the cost of prescription drugs for senior citizens, making sure that people can get preventative care without copays. The Republicans want to yank that all away, and they don't have a plan to provide that health security. Interestingly enough, the other day in the Wall Street Journal, a full discussion about how this health care pact is entrepreneurial, because people who feel that they're job locked will now go out and be able to start businesses because they know they'll have health care insurance for themselves or for their spouses or for the kids, and they'll be able to become the entrepreneurs they want to be. There's a discussion among large employers because people will leave and take their ideas and start their own businesses. That's what this health care enables Americans to do for the first time, not be locked into a job because of the fear of the insecurity of not having health care for your family and what that means. This is an entrepreneurial act. This is liberating people. This is freeing people from the financial fear of the loss of health care. Never again, with the passage of this legislation, will an American lose health care because they lost their job, because somebody died in their family, because a child was born with a pre-existing condition. Never again. The Republicans don't have an alternative. They only have obstruction and repeal as part of their program. I yield back the balance of my time.
Gentleman reserves. Gentleman from Tennessee is recognized.
I yield myself 2 minutes.
Gentleman is recognized for 2 minutes.
I thank the Speaker. Today I rise in strong support of H.R. 45, the repeal of a flawed health care reform bill. I came to this body 4.5 years ago understanding that the greatest problem with the American health care system was cost and access. I knew this because I practiced medicine in East Tennessee for 31 years. I also had been involved with health care reform in Tennessee beginning in 1993 with our attempt to reform our Medicaid program called TennCare. I knew here what not to do. Obamacare is what not to do. We saw costs skyrocket, and we saw our then Democratic governor cut benefits and cut the rolls, therefore rationing care. We need health care reform today in this country, but we need patient-centered health care reform where patients, their families, and their physicians make health care decisions, not government bureaucrats with 20,000 pages worth of rules or insurance companies. Health care should not be a partisan issue. I, as a physician, have never seen a Republican or a Democrat heart attack. I've never operated on a Republican or a Democrat cancer in my life. We were made promises during the health care debate. Your insurance premiums would go down. Jobs would be created. Access would be expanded. What's really happened? Insurance premiums have skyrocketed by as much as 100%. We're looking at tax increases for individuals, taxes on productive company, taxes on life-saving medical devices. Small business owners are being forced to cut hours, delay investments, stop hiring just to stay afloat. This comes at a time when families need more income to make ends meet, not less hours to work and higher insurance premiums. Are patients getting lower costs? It's an emphatic no. And maybe the biggest insult of all, the IRS will determine if your insurance coverage is adequate. Mr. Speaker, I stand ready to repeal this flawed bill and work with my Democratic colleagues on health care reform that will truly work for the American people, and I yield back the balance of my time.
Gentleman reserves. Gentleman from California is recognized.
4 minutes. The gentleman from New Jersey, Mr. Andrews.
Gentleman from New Jersey is recognized for 4 minutes. Without objections, ordered.
I thank my friend for yielding. It is right and good that people should passionately pursue their points of view in democratic debate. But it's also our obligation to work from the same set of facts. And I've sat here and listened to my friends for the better part of an hour, and I do think it's important that we reflect a correct record on a lot of things. First of all, about the deficit. We have a neutral referee here about questions about spending and taxes called the Congressional Budget Office. And several members of the other side have approvingly quoted what the CBO says on different things. Here's what the CBO says about this law. Repealing this law will add at least $100 billion to the deficit. Now, our friends disagree with that, but the referee that they hired, that we live by, says repeal of the law adds $100 billion to the deficit. We hear that health insurance premiums have gone up by an average of $3,000 per year. I don't know the source of that claim. Someone should share that with us. But I do know this. The cost control strategies in the new law, which involve the establishment of a competitive insurance market, so the insurance companies don't have huge market control, hasn't taken effect yet and doesn't take effect until January the 1st of 2014. This is characterized as government control of health care. Here's what the law actually says. It says a person without health insurance can get a subsidy to choose among private insurance plans like Blue Cross and Blue Shield, like Kaiser Permanente, and make their choice. There is nothing in this law, and I would challenge any of my friends on the other side, Mr. Speaker, to show us one word that says that the doctor-patient relationship is in any way impeded or impaired by this law. They can't find those words because they're not there. The bill is referred to as a job-killing health care law, right out of the polling and focus groups of the Republican Party. Here's the facts. In the months before the law was signed, the country was bleeding jobs. 750,000 jobs lost in the month of January of 2009 when the President was inaugurated. Since the law was signed, the private sector has added 3.5 million jobs. Now, you can argue, well, it would have been 4.5 or 5. I have that argument if you want. But since the law was signed, the number of jobs in the private sector has gone up by a lot, not down. That's what the private sector has done. One of the gentleladies referred to the CBO saying 800,000 jobs are being lost. Apparently CBO is okay in that fact. Here's what that report really says. It says that a lot of people who are older, in their late 50s and early 60s, who are working because they feel they have to work for health insurance, are likely to take early retirement. That's where the 800,000 job difference comes from. That's what the report says if you read it. We've heard Obamacare is a tax. That is true. Obamacare is a tax on two kinds of people. People with investment income in excess of about $250,000, and people who can afford health insurance, choose not to buy it, and choose to have our neighbors and our constituents who do buy health insurance pay their bills when they go to the emergency room. That is true. We've heard we have to protect the Constitution. Well, we are protecting the Constitution. With all due respect, your side litigated this and lost. The Supreme Court of the United States heard the claim this is unconstitutional and said you were wrong. Finally, we hear about the assault on the 40-hour work week. Massachusetts, under a governor named Romney, did something very similar to this law, imposed an employer mandate. Here's what happened in Massachusetts. While the rest of the country was shedding 3.6% of its full-time jobs, Massachusetts lost, can I ask for 30 more seconds?
The gentleman is recognized for 30 more seconds.
I thank my friend. Massachusetts lost 2.8% of its full-time jobs. Massachusetts added 0.9% of part-time jobs to the workforce. The country was 0.8. So if this bill is going to force all of these employers to drop their hours from full-time to part-time, why didn't it happen in Massachusetts? This has been a fact-free debate up until this time. The country deserves better. The House deserves better. We should oppose this absent-minded repeal. I yield back.
Gentleman's time has expired. The gentleman from California reserves, and the gentleman from Tennessee is recognized.
Madam Speaker, I yield myself 15 seconds.
Gentleman is recognized.
I just left my office, the Tennessee Insurance Commissioner, who said the 1st of January, at the individual market, a 40 to 75% higher premiums. The small group market, 50 to 55% higher. Plans would be less rich with higher copays, higher deductibles. Young, healthy males get a huge increase. Instead of having 8 statewide plans, we're now down to 2 and maybe 1. And now, yield back. I now will yield 1 minute to Steve Daines from Montana.
The gentleman is recognized for 1 minute.
Earlier this week, I sent an online survey out to my constituents with one simple question: do you support efforts to repeal Obamacare? Thousands of Montanans responded, and by a 3-to-1 margin, they made it clear that Obamacare needs to be repealed. And as we speak, the American people are lighting up Twitter. Check it out yourself. They're tweeting about the harms of Obamacare in 3 words. Actually, the hashtag is Obamacare in 3 words. But while Americans are saying things like job-crushing mandates and premiums are skyrocketing, 1 hour ago, the White House tweeted back and said this: because it's law. Well, I have 3 words for the White House: arrogance of power. Mr. Speaker, if the President is unwilling to listen to the voice of the people, then the House will, because this is the people's house. Obamacare is a bad law, plain and simple. I was elected to serve the people of Montana and represent their voice in this Congress, and that's what I'm doing today. Montanans have spoken loud and clear. They want this law repealed, and that's why I will vote to repeal it. Thank you, and I yield back my time.
Gentleman's time has expired. The gentleman from Tennessee reserves, and the gentleman from California is recognized.
I yield 2 minutes to the gentleman from Virginia, Mr. Scott.
The gentleman is recognized for 2 minutes.
Thank you, Madam Speaker. Madam Speaker, I rise today in opposition to the Patients' Rights Repeal Act. Today, if people want to talk about repealing health care reform, it's important that they talk about exactly what repeal means. Repeal means that young people under 26 will have to get off of their parents' policies. Repeal means that seniors will have to suffer through the donut hole that we're in the process of closing. Repeal means an end to tax cuts to small businesses who are providing health coverage for their employees. Repeal means that next year all Americans who expect to be able to afford health insurance will not be able to afford it, and all Americans with pre-existing conditions who expected to be able to buy health insurance at the standard rate will not be able to buy it. Repeal means that those who think they will need health security if they switch jobs, they'll lose that security when they switch jobs. So repeal means an end to the laws against insurance abuses like unreasonable rate increases and cancellation of policies when you most need them. There will be an end to that if we repeal. If people want to talk about repealing the Affordable Care Act, they should talk about what's going to happen to young people, to those with pre-existing conditions, to seniors in the donut hole, and the future affordability of health care. Madam Speaker, we should not repeal the Affordable Care Act. We should oppose the legislation, and I yield back the balance of my time.
The gentleman yields back. The gentleman from California reserves, and the gentleman from Tennessee is recognized.
Thanks, Madam Speaker. I'll now yield 2 minutes to my good friend, Dr. Larry Bushong from Indiana.
The gentleman is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise today in strong opposition to Obamacare for the reasons we've heard already here today. However, I would like to explain how this train wreck is affecting Indiana and costing good-paying Hoosier jobs. Indiana is home to over 300 medical device companies, creating over 54,800 jobs that pay an average salary of $59,706 per year. And the medical device industry provides $50 billion to Indiana's economy. Companies have already decided not to expand, and many across the country have announced layoffs. The device tax is so dangerous that our friends in the U.S. Senate voted recently 79-20 to repeal the medical device tax. In the last Congress, the House voted in a bipartisan manner to repeal the tax. Yet we've heard from the White House that the President doesn't support repeal because they need the money to support Obamacare. The tax is a job killer and stifles innovation, must be repealed. Obamacare is full of all these type of examples. This near-government takeover of our nation's health care system is riddled with more taxes, burdensome regulations, and unintended consequences that are costing jobs and compromising the quality of health care available to Americans. Not to mention, many full-time employees are being cut back to part-time so that employers can comply with all the requirements of the law. My constituents are telling me that this is happening as we speak back in Indiana. Before coming to the House, I practiced medicine for over 15 years. That experience tells me this law fails to help patients get access to quality, affordable health care, prevent businesses from expanding, and is not helping us create much-needed jobs. It also puts government bureaucrats between the patient and their doctor. Government bureaucrats in an agency that is intrusive, untrustworthy, and targeting American citizens based on politics. Yes, Madam Speaker, Obamacare vastly expands the IRS and is dependent on the agency for its implementation. That's why I'm proud to stand here today with my colleagues to support our nation's patients by voting to repeal this disastrous law so we can replace it with common sense, patient-centered reforms. I yield back. Thank you.
The gentleman's time has expired. The gentleman from Tennessee reserves, and the gentleman from California is recognized.
I yield 2 minutes to the gentlewoman from New York, Ms. Velasquez.
The gentlelady is recognized for 2 minutes.
Thank you. I thank the gentleman for yielding. Madam Speaker, I rise today in opposition to the Patients' Rights Repeal Act. The U.S. Supreme Court's ruling upholding the health care bill was an historic win for this nation's small businesses and their employees. In fact, 62% of all small businesses didn't have access to health insurance for themselves, their employees, and their families. That ruling proved that the Affordable Care Act was a good law. The benefits small businesses are already seeing reiterate this fact. And yet, we find ourselves voting again on repealing this landmark law. Once more, we must vote on a bill that will not help a single small business invest, hire, or secure loan. You want to help small businesses? Put people back to work. In addition to the small business health care tax credit, which has already helped 360,000 small businesses, providing health insurance to up to 2 million workers in this country, the medical loss ratio has ensured that businesses of all sizes were getting the most out of their premium dollars, saving nearly $322 million, money that they could put back into their companies. The future of health reform holds more promise. Banning denials for pre-existing conditions reduces job loss and encourages more than 1.6 million prospective entrepreneurs to launch new companies. At a small business hearing last month, Ms. Louisa McQueenie credited the ACA with providing her company better coverage and greater peace of mind. The ACA will soon prohibit insurers from hiking rates on small firms without justification and end discrimination based on gender. So I agree with Ms. McQueen when she says, frankly, it cannot come soon enough.
Gentlelady's time has expired.
I yield the gentleman 30 additional seconds.
The gentlelady is recognized.
Thank you, the gentleman, for yielding. Contrary to Republican beliefs, the ACA gives small businesses better access to quality coverage. Passage of today's bill will strip new protections that provide bargaining power to small companies. That is why I will continue to oppose any efforts repealing a law that is beneficial to millions of small firms, and I urge our colleagues to vote no. Thank you, and I yield back the balance of my time.
The gentleman from California reserves, and the gentleman from Tennessee is recognized.
Thank you, Madam Speaker. I now yield 2 minutes to Tom Cotton from Arkansas.
The gentleman is recognized for 2 minutes.
Every time Cato the Elder spoke in the Roman Senate, he said, whatever the topic, Carthage must be destroyed. As long as Carthage survived, the freedom and prosperity of the Roman people would never be secure. As then with Carthage, so now with Obamacare. As long as it remains on the books, the health, prosperity, and freedom of the American people will never be secure. Obamacare raised $700 billion from Medicare, meaning seniors across Arkansas will have their health care rationed as doctors refuse to see new Medicare patients. Obamacare creates an unelected and unaccountable panel of bureaucrats to ration and deny needed medical care to Arkansas seniors. Obamacare will cause insurance premiums to skyrocket by as much as 60 to 100% for Arkansas families. Obamacare raises 21 taxes by more than $1 trillion and will cost at least $1.7 trillion in the first decade alone. Obamacare violates our freedom of conscience by using taxpayer dollars to fund abortion. Obamacare is corrupt to its rotten core. The government has exempted hundreds of the president's cronies from the law. The Secretary of Health and Human Services is right now shaking down private companies for millions of dollars to promote Obamacare. And of course, the IRS, expanded by 2,000 agents, will be the main enforcement agency for Obamacare. The very IRS who we now know targets the president's political opponents for harassment and intimidation. Madam Speaker, Obamacare must be repealed. I urge the Congress to repeal this abominable law, and I urge the American people to vote out of office every politician who voted for it 3 years ago.
Gentleman from Tennessee reserves. The gentleman from California is recognized.
I yield 2 minutes to the gentleman from Connecticut, Mr. Courtney.
The gentleman is recognized for 2 minutes.
Thank you, Madam Speaker. Madam Speaker, I rise today in opposition to the Patients' Rights Repeal Act. This is now number 37. The 37th time that we have debated this issue, and we've now built up quite an archive of hysterical predictions by the Republicans during all these debates and 3 years of experience to see how those predictions have actually panned out. Prediction number 1, Obamacare was going to kill Medicare Advantage plans. Has that happened? No. In 2013, this year, 14.5 million Americans have enrolled in Medicare Advantage plans, up from last year, which was 12.8 million. And while the enrollment is up, the cost has stayed flat even. The monthly premium, average monthly premium for Medicare Advantage this year versus last year went up $1 a month. Health savings accounts. The GOP said that the Obamacare would kill health savings accounts. This year, in 2013, health savings accounts have never been higher. 13.5 million Americans are in health savings accounts, up from 11.4 million in January 2011. The president of the Health Savings Administrators was quoted recently saying, "You're going to see an explosion of health savings assets." We have heard that it's going to kill jobs. We've already heard from Mr. Andrews, 6.7 million new private sector jobs have been created since March of 2010, many of them, by the way, in health care, over 800,000. But lastly, all the predictions about busting the budget and creating higher new costs. We heard yesterday from the Congressional Budget Office that Medicare cost growth has been at the most moderate level since Medicare was created in 1965. The index of per capita Medicare expenditure last month rose less than 1%. Again, shattering records over the history of the Medicare program. And it's doing it it the smart way, by greater oversight of fraud, by better coordination of care, by more preventive care, such as giving seniors the prescription drugs that the Republican prescription drug program denied them back in 2003. This program, like any program, can always be improved. And I've worked with Mr. Rowe, Dr. Rowe, in terms of the IPAB repeal. Let's do that. Let's stop wasting our time on a mindless repeal of measures that are working. I yield
the gentleman from California reserves, and the gentleman from Tennessee is recognized.
Thank you, Madam Speaker. I'll now yield 1 minute to Keith Rothfuss from Pennsylvania.
Gentleman is recognized for 1 minute. Without objection. Gentleman is recognized.
I thank Dr. Rowe for yielding. Madam Speaker, I rise in support of H.R. 45. President Obama made a lot of promises when pushing his health care law through Congress. He promised that it would make health care more affordable and accessible. He promised that if you liked your health care plan, you'd be able to keep it. Western Pennsylvanians will tell you that President Obama has failed to keep these promises. We recently saw one of these failures when the Community College of Allegheny County reduced the hours of many part-time employees because it could not afford the increased cost of health insurance. This is just one of the many sad side effects of a law that puts the government in the driver's seat of our health care system while taking patients and doctors along for the ride. Western Pennsylvanians do not want a law that will turn a doctor's waiting room into the waiting room for the Department of Motor Vehicles. They want common sense and patient-centered reform that makes health care more affordable and accessible for workers, seniors, and families. Thank you, Madam Speaker. I yield back my time.
The gentleman from Tennessee reserves, and the gentleman from California is
I
recognized.
yield 1 minute to the gentleman from California, Mr. Cardenas.
The gentleman is recognized for 1 minute.
Thank you, Madam Speaker. I rise today in opposition to the Patients' Rights Repeal Act. This is the 37th time Congress is wasting time attempting to repeal this law. My friends across the aisle could focus putting this helpful and urgently needed law into effect. 41 million more Americans will have the opportunity to get health care under this law. 1 in 4 of them are hardworking Latino Americans who want to protect their families and provide for them. They will finally be able to live without fear that they are not one illness away from going into bankruptcy. Now you want to take that promise away from them. Earlier this year, my friends across the aisle committed themselves to engaging Hispanic Americans. How can they say they generally want to address our needs when they vote to destroy a law that's vastly going to represent 41 million Americans having access to health care, and of those, 10 million Latinos having access to health care? Point of personal privilege, Madam Speaker, I'd like to take the opportunity to thank my wife for being married to me for 21 years. Today is our anniversary, and here I am on the floor working, and hopefully we'll have some good work done today. Thank you very much. I yield back the balance of my time, Madam Speaker.
His time has expired. The gentleman from California reserves, and the gentleman from Tennessee is recognized.
I think, Madam Speaker, before I recognize Mr. Wilson, just very briefly, Republicans and Democrats did vote to repeal the 1099, the IPAB repeal, Device Tax Class Act, and we hear we didn't have any solutions. 80 amendments to this bill. None of them are ruled germane to the bill. I had 10 amendments I wanted to work with the other side. Republican substitute was voted, which is across state lines, association health plans, actually funding high-risk pools for pre-existing conditions, HSAs, and consumer-driven, putting the patient in charge of health care decisions. I now yield to my good friend from South Carolina, Joe Wilson.
The gentleman from South Carolina is recognized for how much time, Mr.
1 minute.
1 minute.
1 minute.
Thank you, Madam Speaker, and thank you, Dr. Rowe, for yielding. Today, House Republicans will vote for the 37th time to repeal or defund Obamacare. Prior to its deal-making passage in 2010, the National Federation of Independent Business, America's largest organization of small businesses, warned that implementation of the government health care takeover would destroy 1.6 million jobs due to mandates and tax increases crippling small businesses. To make matters worse, at a time when our nation is experiencing record unemployment, President Obama has called on the IRS, an agency currently in the midst of scandal, to create thousands of new agents to enforce Obamacare. Based on the recent reports, it's clear IRS should not be expanded to include the authorization of controlling health care for the American people. Today's vote will give us an opportunity to repeal a crucial job-killing, destroying bill that in turn will provide small businesses the certainty they need to begin hiring again and put American families back to work. As a proud co-sponsor, I urge my colleagues on both sides of the aisle to vote in favor of the bill. I yield my time.
The gentleman's time has expired. The gentleman from Tennessee reserves. The gentleman from California is recognized.
Could I ask the chair, inquire of the chair, how much time is available on both sides?
The gentleman from California has 4.5 minutes remaining. The gentleman from Tennessee has 7 3/4 minutes remaining.
I'll reserve. Thank you.
The gentleman from California reserves. Gentleman from Tennessee is recognized.
Thank you, Madam Speaker. Now at this time it's my pleasure to yield 1 minute of time to the Republican Majority Leader Eric Cantor of Virginia.
The gentleman is recognized for 1 minute.
Thank you, Madam Speaker, and I thank the gentleman for the time. Madam Speaker, today I rise in support of the full repeal of Obamacare. Moms and dads across America are worried. They're worried about their health, the health of their kids, the health of their aging parents. They're struggling to understand how the new health care laws will affect their prescription prices, their emergency room visits, whether they can keep their doctor, or worse, whether they can keep their job. These families want the best for themselves and their children, and so do we. House Republicans want patient-centered health care reform that lowers costs, increases access, makes the health care system easier to enter and easier to navigate. Obamacare is not the answer. While both parties agree that we must make health care more accessible, we in the majority fundamentally disagree that more government is the answer. Sweeping mandates on individuals and businesses will not improve our health care. We do not wish to see unelected federal bureaucrats come between patients and their doctors, limiting choices, lowering quality, and raising costs. Madam Speaker, this act, which is the Obamacare law, which is set to be implemented 8 months from now, is a threat to American patients and their families. When this law was first debated in 2009 and signed in 2010, the White House promised the American people that Obamacare would lower costs for families and businesses. That promise has been broken. Nothing could be further from the truth. If you like the health care coverage you currently have, you really don't know if you'll be able to keep it under Obamacare. Many employers are delaying hiring decisions because of provisions outlined in the law. And people with pre-existing conditions are now being denied the coverage the President promised. There are more complaints about the law than praise, and for good reason. It is now projected that Obamacare will send health care premiums skyrocketing in the individual and small group insurance markets. When fully enacted, this law is expected to pose new financial burdens on America's youngest adults and many working families. Moreover, due to the projected cuts to Medicare Advantage, many of our seniors will face a type of health care that they didn't bargain for. This act should not be considered a reform, but a bureaucratic overreach that makes a mess out of our health care system and gives incredible power to the Internal Revenue Service. President Obama has already signed 7 bills originating in the House that repeal or defund parts of this health care law, but if we are serious in wanting to deliver real results for the people who sent us here, we should repeal Obamacare and replace it with the health care that the American people desire. Thank you, and I yield back.
The gentleman yields back. The gentleman from Tennessee reserves. So the gentleman from Tennessee is recognized.
Thank you, Madam Speaker. I'll now yield 1 minute of time to my friend from North Carolina, Richard Hudson.
The gentleman is recognized for 1 minute.
Thank you, Madam Speaker. Now, I don't have much in common with the leadership in the Senate, but today I stand in agreement with Senator Max Baucus, who characterized the implementation of Obamacare as a train wreck. Disasters occur when the government oversteps its bounds. We've seen it with Obamacare as the most egregious example, but we've also seen this week what happens when federal agencies target people for their political beliefs, We've seen the same kind of overreach with violations of the First Amendment rights of reporters and journalists, and in the failure to answer questions about the origins of the terrorist attack in Benghazi. Legislatively, Obamacare is the most egregious example of government overreach we've ever seen, and a disaster, ladies and gentlemen, is ensuing. Hardworking Americans are losing their jobs, families are paying more in taxes, and seniors are losing much-needed Medicare coverage. And this bill hasn't even been fully implemented yet. Health care has always been and should always be a relationship between a patient and a doctor of their choice, not a government mandate to be managed by faceless bureaucrats in Washington, D.C. The federal government has no authority to be the managers of the physical well-being of every American. I support full repeal. Thank you.
Gentleman from Tennessee is recognized.
I'll reserve. Gentleman
reserves. The gentleman from California is recognized.
We only have 2 speakers left, so we only have 4 minutes.
The gentleman from California reserves, and the gentleman from Tennessee is recognized.
Could I inquire about the time?
The gentleman from Tennessee has 5 3/4 minutes remaining, and the gentleman from California has 4 1/2 minutes remaining.
Thank you, Madam Speaker. I now will yield 1 minute of time to Randy Weber from Texas.
The gentleman is recognized for 1 minute.
Thank you, Madam Speaker. I rise to implore Congress to listen to the American public and to pass H.R. 45. If you think the Unaffordable Care Act is a good deal, then as an American you have to ask yourself, do you believe the IRS acts in your best interests? My conservative guess is not on the best days. Ask yourself, were all the events swirling around Benghazi shrouded in mystery or bathed in sunlight and transparency? Not on your life. Ask yourself, were the phone records of the AP reporters and the privacy that should have been afforded to them, were they protected? Not on the best days. Ask yourself, is the government here to help? No. The government that is in the process of bankrupting Social Security, bankrupting the post office, on the verge of killing Medicare and Medicaid, now wants to come tell us, trust us. We're from the government. We're here to help. Madam Speaker, I don't think the American public can afford that kind of trust or help. The answers are not here in Washington, D.C., but they're back with Americans. Listen to the American public. I'm Randy Weber. Let's pass H.R. 45. That's the way I see it.
Gentleman's time has expired. The gentleman from Tennessee is recognized.
Reserve.
The gentleman reserves. The gentleman from California is recognized.
The previous speaker, I yield myself 2 minutes.
The gentleman is recognized for 2 minutes.
The previous speaker just said that we should listen to the American people. When the American people listen to the Congress of the United States, they would assume that all the Republicans in the country are against this health care bill and all the Democrats are for this health care bill. But if you look at the Kaiser Family Foundation, most recent poll on this, you'll find out that 96% of the Democrats and 83% of the Republicans support the tax credits for small business that are now the law of the land, and 360,000 small businesses are getting those tax credits. 90% of the Democrats and 74% of the Republicans support closing the donut hole, and the donut hole is in the process of being closed. Democrats and the Republicans agree in the country that this is a good deal. 87% of the Democrats are excited, and 72% of the Republicans, about the creation of health care exchanges where they can go and shop for health care, just as the members of this Congress do in open season, where they can pick and choose from different plans. In California, there'll be 33 plans offered by private health insurance companies that they can pick and choose from. They think that's a good idea. They think it's a great idea. 84% of the Democrats and 68% of the Republicans think it's a great idea that children will not be thrown off their parents' policy, as is the law today. As is the law today. That's why you've only voted to repeal. On the first day you took the majority in this Congress, you voted to repeal, and you instructed the committees to come up with an alternative. You've had 37 votes on repeal, and you've had no action by the committees on the alternative. So you have a plan that is meeting the needs of American families, millions of Americans, of all walks of life, small businesses, big businesses, employees of both, children, seniors, people with pre-existing conditions, and your answer is to repeal, like that's progress. No, that's not progress. That's the failure to have an alternative and creative thinking about how to deal with the health care problems of the American people. The Obamacare Act does that, the Affordable Care Act does that, and that's what this Congress did. And I
Gentleman's time has expired. The gentleman reserves, and the chair would like to remind the members to address their remarks to the chair. Gentleman from Tennessee is recognized.
Thank you, Madam Speaker. I'll now like to yield 1 minute of time to Scott Perry of Pennsylvania.
The gentleman is recognized for 1 minute.
Thank you, Madam Speaker. In 2010, this body was told by Speaker Pelosi it needed to pass the bill so the American people could know what's in it. Well, Mr. Speaker, if the American people would have known of the toxic consequences that Obamacare would have, I'm certain they would not have allowed this legislation to be passed. I rise today to expose some of the ramifications that Obamacare will have on Americans when it is fully implemented in 2014. In my home state of Pennsylvania, premium rates in the individual market will increase by approximately 30%. And on a national level, there will be a 73% rise in premium costs for those keeping insurance. For those interested in getting a new plan, you're going to see an average increase of 100% in costs compared to today. Due to the employer mandate, as many as 20 to 65 million Americans will likely lose their employer-sponsored health care. Well, Mr. Speaker, 3 years later, and we still don't know everything in this legislation, but we do know who's picking up the tab. It's hardworking families and job-creating small business owners. And I yield back.
The gentleman's time has expired. The gentleman from Tennessee reserves. And the gentleman from California is recognized.
I yield the minority leader 1 minute.
The gentlelady is recognized for 1 minute.
Thank you, Madam Speaker. I thank the gentleman for yielding, and I thank him for his leadership and that of Mr. Levin and Mr. Waxman as the chairs of the 3 committees when this legislation